What is the priority nursing intervention for a client with a suspected bowel obstruction? A. Administering laxatives. B. Encouraging ambulation. C. Inserting a nasogastric (NG) tube. D. Administering antidiarrheal medication. The correct answer is C. Inserting a nasogastric (NG) tube. Rationale: inserting an NG tube can help decompress the bowel and relieve symptoms in clients with bowel obstruction. Which of the following findings should the nurse prioritize when assessing a client with acute pancreatitis? A. Hypotension. B. Bradycardia. C. Hypoglycemia. D. Abdominal pain radiating to the back. The correct answer is D. Abdominal pain radiating to the back. Rationale: abdominal pain that radiates to the back is a classic symptom of acute pancreatitis and requires immediate attention. What is the priority nursing intervention for a client with a tracheostomy tube who experiences sudden respiratory distress? A. Administering oxygen. B. Suctioning the tracheostomy tube. C. Changing the tracheostomy ties. D. Administering a bronchodilator. The correct answer is B. Suctioning the tracheostomy tube. Rationale: suctioning the tracheostomy tube helps clear secretions and improve airflow in clients experiencing respiratory distress. Which of the following interventions should the nurse prioritize for a client with suspected acute renal failure? A. Administering potassium supplements. B. Restricting fluid intake. C. Monitoring urine output. D. Encouraging a high-protein diet. The correct answer is C. Monitoring urine output. Rationale: monitoring urine output is essential in assessing renal function and detecting changes indicative of acute renal failure. What is the priority nursing intervention for a client with a suspected overdose of acetaminophen? A. Administering activated charcoal. B. Administering an opioid antagonist. C. Providing emotional support. D. Encouraging the client to drink fluids. The correct answer is A. Administering activated charcoal. Rationale: activated charcoal helps absorb toxins and can reduce absorption of acetaminophen in cases of overdose. Which of the following actions should the nurse prioritize when caring for a client with a new colostomy? A. Irrigating the stoma. B. Applying petroleum jelly to the stoma. C. Emptying the ostomy pouch regularly. D. Avoiding the use of ostomy appliances. The correct answer is C. Emptying the ostomy pouch regularly. Rationale: regular emptying of the ostomy pouch helps prevent skin irritation and leakage. What is the priority nursing intervention for a client with a suspected pneumothorax? A. Administering oxygen. B. Preparing for chest tube insertion. C. Encouraging deep breathing exercises. D. Placing the client in a supine position. The correct answer is B. Preparing for chest tube insertion. Rationale: chest tube insertion is necessary to re-expand the lung and relieve pressure in a pneumothorax. Which of the following findings should the nurse prioritize when assessing a client with a traumatic brain injury, TBI? A. Hyperthermia. B. Hypotension. C. Slurred speech. D. Unequal pupil size. The correct answer is D. Unequal pupil size. Rationale: unequal pupil size, anisocoria, may indicate increased intracranial pressure and requires immediate intervention in clients with TBI. What is the priority nursing intervention for a client with a suspected overdose of benzodiazepines? A. Administering naloxone. B. Providing emotional support. C. Administering activated charcoal. D. Administering flumazenol. The correct answer is D. Administering flumazenol. Rationale: flumazenol is a benzodiazepine receptor antagonist used to reverse the effects of benzodiazepine overdose. Which of the following interventions should the nurse prioritize for a client with a new diagnosis of heart failure? A. Encouraging a low-sodium diet. B. Administering a beta blocker. C. Providing frequent rest periods. D. Encouraging smoking cessation. The correct answer is A. Encouraging a low-sodium diet. Rationale: a low-sodium diet helps reduce fluid retention and manage symptoms of heart failure.
Thank you very much.